So today we'll be discussing a small topic called as tarsorrhaphy. Tarso meaning the margin of the eyelid and raphy meaning the union of the two halves, right? So any condition when you see an improbable repair of the cornea or you see a permanent damage to the eye, you would find it better to do tarsorrhaphy, basically close the eyelids permanently. Now the catch is this could happen two types basically. One is the temporary type and then the permanent type. When you're talking about the temporary type, we have specific indications for that. Like when you see the seventh nerve is damaged currently, but post 2 months, maybe the seventh nerve could recover. In that kind of a condition, you would you do a temporary tarsorrhaphy, and then if there is a lazy ulcer like an indolent ulcer, in that kind of a condition, you would help the healing process by doing tarsorrhaphy, which would be a temporary type. And then if you have placed a skin graft already in the eye, then you would choose to do a temporary tarsorrhaphy, so as to open the tarsorrhaphy later, so as to let the skin graft fix in. The catch is this temporary type of tarsorrhaphy could be done in two types. One is the the paramedian type of it, and then you have the median type of it. And this paramedian type, so basically what you do is paramedian is in and around the median, right? So what you do is basically 3 millimeter from the midline of the eyelid, somewhere on the gray line. What you do is 3 millimeter to the left and 3 millimeter to the right, you take an incision which would be of the depth of 2 millimeter. And but you have to make sure that anteriorly the ciliary line is not damaged and posteriorly the sharp lid border is not damaged. The anteriorly the ciliary line and the posteriorly the sharp lid border is not damaged. And you take out the flap, you take out the eyelids margins flap. Basically the epithelium is removed, and this would be the process of removing it. And then suturing it, you take a double armed 6-0 silk suture, and then you suture it. The catch is, this would be a diagram of the paramedian tarsorrhaphy. Here you can see in and around the median, they've taken an incision, and then they have there would be a marked area. So before you start the surgery, there would be a marked area where you have to take out the flap. That would be the temporary part. When you're talking about the permanent part, so when you have a condition like the seventh nerve is damaged and there's no recovery for it, or if there is a neuroparalytic keratitis, you would like to take an incision on the lateral canthus because it causes permanent adhesions, and you would take a triangular flap. Basically on the upper eyelid you take a triangular tarsoconjunctival flap, whereas on the lower eyelid you take you take out the orbicularis and the triangular flap, and then suture them. So this would be a small topic of tarsorrhaphy.